In this video, I'm going to tell you some of the highest paying work from home healthcare jobs for women. Hi, I'm Lopez coming at you with another video from LopezInsane.com. In this video, I'm gonna give you some healthcare jobs, some of the highest health paying jobs for women, and I'm going to tell you where to apply for it as well. So sorry guys, this is just for the ladies. I'll get you on the next one. So, one of the highest paying jobs for women in the healthcare field is speech language pathologist. And it's an example of it's an example of a specialist who can work at home or in the homes of others. If you enjoy the art of communication and helping others communicate, consider this option. SLPs help patients with difficulties pertaining to speech, language, and voice. They also work with cognitive components such as attention and memory. So I guess they work a lot with people that had strokes, people that are in kind of like recovering. So yeah, they on average they make $76,000 a year based on the BBC. Oh, I'm sorry, Bureau of Labor Stats, BLS. 76,000. That's so you can be bilingual, bilingual therapies, EBS healthcare, global therapy, ProCare therapy, and I'm going to link this website underneath the video. So it has all the jobs that I'm going to talk about, plus the websites as well. So, so you won't get confused or anything like that. And next, you can be a medical coder. Now, I'm familiar with a medical coder, very familiar with it. It says medical coders review the diagnostics of records for physicians, nurses, and other health professionals and translate them into the code necessary to file insurance claims. Okay, so I know what medical coders do. And they get paid on average $39,000 a year based on the BLS. So that's not bad. That's just, you can apply at Flex Jobs, iMedX. I never heard some of these websites, but like I said, I'll put the link in the below the video. You can be a psychologist or therapist, and the average pay for a psychologist is $77,000. And some of this is going to be based on where you live too. Yeah, that's pretty much how most jobs are. It's based on where you live, city, small town, etc. So you can apply for this job as a shrink at BetterHelp.com, DoctorsOnDemand.com, GlobalTherapy.com, UnitedHealthGroup.com. That's an insurance company. And you can be a midwife. Now, a midwife, they help, for the most part, they help women have babies. So, I think the midwife has been kind of, at least they tried to take the midwives out of the equation due to the Western philosophies of having babies. But I think a lot of midwives are making their way back in society, it seems like. It says that because increasing numbers of women are electing to have their babies at home, the demand for certified midwives is rising. A midwife assists with everything from prenatal care and delivery to routine exams and other aspects of maternal health. It's necessary in this profession to visit the homes of your patients, but your routine paperwork and planning can be done from home. Yeah, so midwives is making a comeback in society because there's a lot of women out here that they don't want to have the babies in the hospital for logical reasons. There's a lot of reasons for that. I'm not going to go into that in this video, and I'm not a doctor, so, but I know, I've done my research and I've talked to a lot of women, and they told me the reasons why they prefer not to have their babies in the hospital. They prefer to have their babies either home or at some type of center away from the hospital. And depending on where you live, they might have those centers available, or you might just prefer to have your baby at home. So you can pretty make very good money being a midwife. I know like 2 midwives. At first I didn't know what a midwife was. I had to ask. I was like, oh, that's what they call a midwife. Because when I was growing up, I knew a lady that helped women have babies, but I didn't know it was a title called a midwife. I just thought it was a lady that helped people have babies outside of the hospital. Go figure. That's how I grew up. We weren't title heavy, in my household. Titles didn't mean much. So next, you can be an occupational therapist. Much like a career in midwife, a career in occupational therapy may mean visiting patients outside of the clinical settings and helping them readjust after illness or injury. Occupational therapist history can be traced to 1910 when a group of OTs argued that a patient's well-being is connected to social and economic factors in addition to psychological factors. You will need a master. So occupational therapist basically works outside the hospital system just like the midwives do. Okay, so you will need a master's degree in occupational therapist, and you got to pass an exam. So you got to be certified just like a midwife, And P.S. and by the way, I forgot, midwives make over $100,000 on average, and I know that for a fact. Yeah, every midwife that I know, they raking in the dough. It's a very lucrative profession to be a midwife. And just like occupational therapists, they make on average $83,000. So I know a midwife back at home. First off, there's not a lot of midwives. That's the first thing. Not where I'm from. Now maybe you live in a big city, of course. That's probably, of course it's going to be more because there's more people living in a big city. But even in a big city, it's not a lot of women that want to be a midwife that work in the medical system. They'd rather work at the hospital. Because as a midwife, you're solo. You're by yourself a lot. Unless you have a helper or something like that. So there's a lot of responsibility. So a lot of women don't want the responsibility. Yeah, so hey, it is what it is. The more money you make, the more responsibility that comes along with it. And a lot of people, they want to make the money, but they don't want the responsibility. So I say you can't have it both ways. It's either or. So as an OT, occupational therapist, you make $83,000, and as a midwife, you make over $100,000 on average. And next, you can be an RN, registered nurse. And obviously, registered nurse, they make pretty decent salaries, pretty good. It's going to vary depending upon, the hospital, or if you work at a nursing home, or your town you live in, etc. It depends on. It depends on how long you've been a registered nurse as well. And you can be a pharmacist. That's the next one. Now, pharmacist. My sister was a pharmacist for 42 years. Now, the difference is when she became a pharmacist, it wasn't. I didn't even know what a pharmacist was. I just thought that she just worked in a pharmacy at the hospital. It wasn't. The job description didn't have an official title when she started 42 years ago. This is in the 80s when she started working at the hospital. So when she started, the wages were very low. But you can make anywhere, I've been hearing anywhere between, on the low end, $55,000 all the way up to $125,000. You know, so you on the low end it's $55,000. Say if you're in a small town with less than 100,000 people, you make $60,000. On the high end, if you live in a town like New York, Chicago, Atlanta, LA, you can make up to $120,000. That's what I've been hearing over the past 20 years. And the BLS, Bureau of Labor Stats, says the average pharmacist make $124,000. So that's pretty much the same neck of the woods where I said. And you can be a physician. A physician is the doctor's assistant, basically. So if you go to the doctor's office, let's say you have an appointment at the doctor's office, and if the doctor can't see you, his assistant will be there, and that's the physician, basically. And all they do is basically take appointments all day. That's what I've been seeing. Of course, I don't go to the doctor, me personally, but I've taken other people there, and every 9 times out of 10, we saw the physician. It wasn't the doctor most of the time. And this person usually is somebody that just came out of medical school, new, fresh, and they want some experience underneath their belt. So they'll work with an established doctor, somebody that's been out there for a long time. And they make pretty good money. I think, if I'm not mistaken, they make up to a little over $200,000 working at someplace like the hospital or doctor's office, or maybe someplace like a plastic surgeon. They can make up to $200,000 if they work for like a plastic surgeon or something like that. So hey man, this is just some career options or fields for men and women, really. This is not just for, these positions are not strictly for women. They're just being dominated by women, most of them, like a pharmacist, midwife. You can be a psychologist as a male, a therapist as a male, medical coder, that's mostly women, speech language pathologist, that's mostly women. Occupational therapist, that could be a man. A registered nurse, that's dominated by women, but it could be a man too. Pharmacist, a physician, that could be a man or a woman. So, so I didn't leave out the guys in this video. So hey, that's all I got in this video. Any questions, concerns, leave your comments below. Like this video, share this video, subscribe to my channel if you haven't already, and I'll be sure to put the link below this video so you can check out all these jobs in the health field. So until next time, I'm out. Peace!